Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, in the last class we have been discussing about some of the viruses which will going to affect the liver. In that series, the first we have covered hepatitis A in detail. So today we shall see hepatitis B virus. Now hepatitis B virus is most dangerous virus, as all of you know, because this is a DNA virus. Now this may lead to long-term complications, and it is very fatal also. Therefore, all the effort has been done to prevent the hepatitis B by means of vaccination, which was almost all successful. Now, talking about the basics of hepatitis B virus, hepatitis B virus has infected the human since at least the Bronze Age. Very old disease. We find number of references telling that this hepatitis B virus was there since the Bronze Age. The evidence was obtained from 4,005-year-old human remains. According to 2018 study, the viral genomes obtained by shotgun sequencing become the oldest ever recovered from the vertebrate samples. It was also found that some ancient hepatitis viral strains still infect the humans while other becomes extincted. This disproved the belief that hepatitis B is originated in the New World and spread to Europe and around 16th century. Now all these references are very important because there is a wrong notion that hepatitis B virus is the outcome of the latest advancement, mechanical lifestyle and all those things. Recent advances and that means the destruction of the nature to some time and our food habits and all those things is the actual cause for the hepatitis B. Like this, there is a wrong notion is there. But all these evidences which tells that hepatitis B is there since the Bronze Age or since a very long back. So this disproves that this is not a newly originated disease because of the human errors and all. Okay, this was there since long. Another in 2018 study, the remains of the mummified child found in the Basilica of San Domenico Maggiore in Naples concluded that the child who had lived in the 16th century had a form of hepatitis B virus, and that virus was closely related to the modern variants. Okay, these are some of the history points. The earliest record of an epidemic caused by the hepatitis B virus was made by Luren in 1885. An outbreak of smallpox occurred in the Bremen in 1883, and about 1,289 shipyard employees were vaccinated with lymph from the other people. Very interesting. After several weeks and up to the 8 months later, 191 of the vaccinated workers became ill with jaundice and were diagnosed as suffering from serum hepatitis. Other employees who had been inoculated with different batches of the lymph remained healthy. Okay, so Lerman's paper hence conclude that now regarded as a classical example of an epidemiological study proved that contaminated lymph was the source of the outbreak. Later, the numerous similar outbreaks were reported following the introduction in 1909 of hypodermic needles that were used and, more importantly, reused for administering the salvarsan for the treatment of syphilis. Now this is what is the root of contamination. The lymph is one of the root of contamination. Even the parenteral contamination of the hepatitis B is very common nowadays. Similarly, through the sexual contact, they have given the example of syphilis. Okay, that means repeatedly using the needle or reusing the needle, drug abuse, etc., in drug abused people, etc. So that is also one of the major cause. Okay, and therefore this particular paper says the salvarsan for the treatment of syphilis. That means they have used the same needle which was used to give the salvarsan as the drug for the treatment of syphilis, and that caused this particular infection. Now, very interestingly, the virus was not discovered until 1966 when Brouch Bloomberg, then working at the National Institutes of Health (NIH), discovered the Australia antigen. Okay, he discovered an antigen and he named it as Australia antigen, which is later known to be hepatitis B surface antigen. Nowadays, the vaccine which we are giving, that is against this antigen only. So okay, later which is known as hepatitis B surface antigen or HBsAg in the blood of the Aboriginal Australian people. Hence the name Australian antigen was given. 1966 when he is working, so he found that there is an antigen present, that is Australian antigen in the blood of Australian people, one of the community there, Aboriginal. Now, although a virus had been suspected since the research published by the Frederick McCallum in 1947, David Dane and others discovered the virus particle in 1970 by electron microscopy. By the early 1980s, the genome of the virus has been sequenced and the first vaccines were being tested. World Hepatitis Day, observed on 18th July, aims to raise the global awareness of the hepatitis B and hepatitis C and encourage the prevention, diagnosis and as well as treatment, because it's a deadly disease. It has been led by the World Hepatitis Alliance since 2007, and in May 2010 it received the global endorsement from the World Health Organization. Now these are all the history points related to hepatitis B virus. Talking about the epidemiology, at least 391 million people, or about 5% of the world's population, had the chronic HBV infection as of 2017. See, 5% of the world's population, it's a very big population. Okay, while another 145 million cases of acute hepatitis B infection occurred that year. Regional prevalence ranged from around 6% in Africa to 0.7% in Americans. The route of infection include, as we know, the vertical transmission. That means such as through the childbirth, because an infected mother of hepatitis B is more probably chance of giving transmission to the baby also. That's called as vertical transmission. Or early life horizontal transmission. In the early life, horizontal transmission like bites, lesions and sanitary habits and drug usage or needle usage, etc. And adult horizontal transmission, in the adults it is like sexual contact, intravenous drug use, etc. So vertical transmission, horizontal transmission in the early life and horizontal transmission in the adult life. The causes are explained. The primary method of transmission reflects the prevalence of chronic HBV infection in the given area. The primary method of transmission reflects what is actually the method of transmission, whether it is by the bites, parental routes, sexual contact, drug abuse people, or by means of infected mother. So primary method of transmission that reflects the prevalence of the chronic HBV infection in the given area. In low prevalence areas such as the continental United States and Western Europe, the injection, drug abuse and unprotected sex are the primary methods, although the other factors may also important. When you talk about United States and Western Europe, where the hygienic methods are very good and they're also aware of their the health prospectus, etc. So there actually the major cause of this hepatitis B infection is mostly unprotected sexual activities and some drug abuse, etc. In moderate prevalence areas, which includes the Eastern Europe, Russia, and Japan, where 2 to 7% of the population is chronically infected, the disease is predominantly spread among the children. Now, in high prevalence areas, what are the high prevalence areas? Like China, Southeast Asia includes India also. So transmission is during the childbirth is most common. Through the childbirth, the transmission is very common, although the other areas of high endemicity such as Africa is also, although in other areas of a high endemicity such as Africa. Some areas it is endemic, okay, but in China, Southeast Asia, if you take childbirth, infected mother giving the infection to the, transmitting the infection to the birth during the time of the delivery, so that is very common. So transmission during the childhood is a significant factor. The prevalence of chronic hepatitis B infection in areas of high endemicity is at least 8%, with 10 to 15% of the prevalence in Africa and East Asian countries. As of 2010 now, China has 120 million of infected people, followed by India and Indonesia with 40 millions and 12 millions respectively. Big number, very big number. Okay, so we have got almost 40 million people who are infected by 2010 data, almost 15 years back data this is. So according to World Health Organization, WHO, an estimated 6 lakh people die every year related to HBV infection. Very big number. In United States, about 19,000 new cases occurred in 2011, down nearly 90% from in 1999. So these are all some of the basic concepts related to, or basic history and epidemiology related to hepatitis B. Now in the next class, we will discuss about the causes and other aspects of the infection. Thank you very much.